Hi, I am Dr. Nunnery. I'm a board-certified physician in family medicine, and I practice here in Houston, Texas. And the question for today is, why telemedicine? If you're a physician sitting on the fence and you're thinking about adding telemedicine to your medical practice, I'm here to speak to you. And you know why? Because I was that doctor. There were three things that happened over the course of 6 weeks' time that made me decide to incorporate telemedicine into my practice. In fact, I heard Dr. Rose speaking about telemedicine at a medical conference, and as soon as I heard her, I knew that telemedicine was the wave of the future. But what I didn't know was that the telemedicine practice incorporated into my own medical practice is truly the wave of now. And these three things kind of happened in alignment to kind of make me make that decision. The first thing was that my daughter said to me, "Mom, you're already practicing telemedicine." And I said, "What do you mean?" And she said, "Well, all these years you take call at night, you take call on the weekends, you talk to patients on the telephone, you answer their questions about their medical care, you listen to their symptoms, and then you prescribe a treatment over the phone. You're already doing it." And a light bulb went off. The second thing that happened was that a new employee was hired into my practice, and she was a phlebotomist, and she talked to a lot of patients who said that they loved me, they loved coming to see me, and she decided that she wanted to be my patient as well. However, she said, "Dr. Nunnery, I can't become your patient because I don't have time to wait in your waiting room. If I could see you on my telephone, I would come." Now, she didn't know that telemedicine existed, and that blew my mind. And I said, "Oh my goodness, that is available. I can see you on your telephone." The third thing that happened a couple of weeks later was that a pharmaceutical rep brought a lunch to my office. And the rep said, "Dr. Nunnery, this morning I was so sick. I really didn't want to cancel your lunch. So I dialed an 800 number and I saw a doctor online. He prescribed medication for me, and I felt well enough to get here today at lunchtime to deliver the luncheon to you." I could not believe it. His insurance company covered for a medical practice of telemedicine online for him to be able to see a doctor online. So I immediately, that day after that lunch, called Dr. Rowe and I joined this telemedicine practice. I want to share with you some ways that I incorporate telemedicine into my practice. I'm a busy physician, I see patients all day, and I use telemedicine in three key ways. The first is that I call back patients' critical test results via telemedicine and discuss that with them face-to-face in a visit like I'm talking to you right now. The second way that I incorporate telemedicine into my practice is that I have slots for telemedicine throughout my schedule for patients who cannot get away from work, or they're stay-at-home moms and they can't get a babysitter to get into my office, or they just don't feel like getting out of bed and they're just too sick to get up. And so I have that strategically set in my day for telemedicine slots, and I go from a live visit, in-office visit, to a telemedicine visit during the telemedicine slot. The third critical way that I use telemedicine in my practice is for urgent care, for after hours and weekends. Rather than phone calls, my patients dial the 800 number and they select me to see me via telemedicine for their urgent care needs. This avoids long wait times for them in urgent care, and it allows continuity of care. So you see that telemedicine really is for now, and you can incorporate it into your medical practice today. I look forward to seeing you partnering with me and Dr. Rowe in our telemedicine practice. Thank you so much and have a wonderful day.